Healthcare Accountability video number 2. Bringing you today, my name is Alan Kopic, founder of Adminology Bay. Greetings from beautiful Kentucky. I'm excited today to bring you the second video talking about the important topic of healthcare accountability. Today we're going to focus on what is it that we're accountable for in healthcare. You know, it's been decades that we've been accountable for some basic things. For instance, we've been accountable for our patients. We've been accountable for the types of outcomes that we're able to achieve with the work that we do on behalf of our patients. We've been accountable to our boards and our local boards of directors and our codes of conduct and those things. But we're now accountable for some things that are different than it has been in the past. Our results now are posted and reported publicly. Hospital results can be seen at Medicare's Hospital Compare website. If you want to find that, the easiest way to tell you is to Google Hospital Compare, and you'll see the Medicare site at medicare.gov where you can compare one hospital to another. And see the types of results, things ranging from infection rates to patient satisfaction scores, comparing one hospital to another. And I think that's helpful. There's also a physician compare website that's available through medicare.gov and a nursing home compare website so that you can get some good information on a comparative basis from one organization or one physician to another. So we're accountable today for things in much different ways than we have been in the past, and I expect the trend will increase as in going into the future. There'll be more and more ways that we are held to account for our activities. As we stated in the first video, what is accountability? It's taking responsibility for the results and an accountability for our activities, and then disclosing our results in a transparent manner. We're also accountable, though, in ways that we haven't been in the past for what our operations cost. What does it cost to deliver the care that we deliver in our organization or in our hospital or in our clinic? And the cost is really an important thing now because the public is saying enough of this spiraling higher and higher costs across the healthcare system, causing us to whole insurance plans changing to high deductible health plans, for instance, with higher co-pays, higher deductibles. That's causing the patients themselves to be more actively involved in the decisions as they relate to cost. And that's going to lead us to a new level of accountability that we've never seen in the past. And that is pressure on healthcare providers, physicians, hospitals, clinics, pressure to provide price transparency. What does that mean? That means the ability for a patient to come into your organization and say, I'm considering having a procedure here, and I'd like to know what the cost is going to be. Now, when you think about it, there's a lot of complexity around that question of what's this going to cost me? But it's the very reason why the expectation is coming about from patients that we should be able to tell them what's my out-of-pocket portion going to be, and what is the overall bill going to be if I have insurance helping me pay part of that. That's a critical piece. And when you think about it, it's a reasonable expectation. Who among us would go into a store to buy groceries or to buy something that we need around the house, and there would be no price tags? Who among us would tolerate that particular store? Most of us would say, well, I'm going to go to a different store where they can give me an accurate price so that I know what I'm going to pay when I pick this item off the shelf and take it through the cashier line and walk out of the store and put it in my trunk of my car. That's a reasonable expectation. So just know that hospitals, clinics, physicians, healthcare organizations in general, more and more are going to feel the pressure to provide price transparency. What is your service going to cost me? What's my out-of-pocket portion? What's the overall cost going to be? So that's one more piece of data that I can consider as I try to choose the best organization, the best facility, the best environment for me to receive an important healthcare service. So healthcare accountability, yeah, it's increasing. I hope if you're a hospital leader or a healthcare leader or physician, you're paying attention. And if you're a patient, I can tell you this, it's going to be better for you in the end. Transparency on the price, it's going to be a good thing. Higher accountability for hospitals and physicians, it's a good thing. So I wanted to kind of bring this to you and maybe help you understand a little more about what's happening in healthcare. It's been tough, but it's also been very positive in its result. Healthcare accountability is here to stay. Thank you, everybody.